Hello again. Now, seeing Sir Chris Hoy taking part in the Children in Need fundraising event was heartwarming. A man used to getting through challenges perhaps, but not a few hundred miles riding on a chopper bike, but it made a point. Despite a diagnosis of stage 4 prostate cancer, the NHS website giving advice about prostate cancer, having had web traffic up by nearly 700% in the days after Sir Chris Hoy's diagnosis was revealed. West Streeting, the Health Secretary, murmuring about reducing the age men may request a screening test, the PSA blood test. From the present figure, about 50 was also touted. In practice, though, men younger than 50 can and do attend the surgery to discuss all this quite regularly. There's often a family history or a concern about symptoms, and they query about having maybe a PSA blood test. Looking at prostate cancer, though, it remains slightly puzzling, a slight enigma. In the UK, annually about 50,000 men are diagnosed with this condition, and about 12,000 of those will have prostate cancer on their death certificates as a cause of death. It's age-related, and it's very unusual in the under 50s. Chris Hoy, of course, is 45 and presented with a shoulder bone tumour, which in fact was a secondary from a prostate tumour itself. That's very, very unusual. A family history of, a father or brother with prostate cancer will increase your risk significantly. And crucially, men from a black ethnic background have a 1 in 4 lifetime risk of prostate cancer versus 1 in 8 approximately for white men. The PSA blood test we will talk about, though, is not by any means an infallible test, and still, although very commonly requested, it's not accurate nor sensitive enough to be sort of rolled out as yet as a national screening test for e.g. men over 50. Much discussion, though, and much debate continues to flow on this topic. Though I can promise you that it will continue flowing. About 75% of men, for example, with a raised PSA for their age on testing, will not have prostate cancer, and some will have a normal PSA, at least initially. Have a peep then at the UK.gov website, specifically at the PCRMP, the Prostate Cancer Risk Management Programme. All you need to know then lies therein. You just need to know where to look. On another topic, last year in England and Wales, there were some 591,000 births. Wow, seems huge, but in fact, it was the lowest figure since 1977, coupled with the lowest fertility rate since records began in 1938 of 1.44 children per female. Extinction awaits then. More locally, not too many plagues about still. There is some, but there's plenty of time yet, fear not. The chattering classes, having been gripped by the assisted dying set of private members' proposals, if you care to listen to the wireless, mirroring what's been happening locally, of course, in the island for a little while. For the NHS, this is such a sea change in attitude and practice for many practitioners. I would not wish personally to find locally we end up with a group of medical staff in a small minority who voluntarily, of course, are then flagged up as available for those patients who are requesting an assisted ending. It's more likely, though, this bill becomes statute and law, it might be an opt-out issue rather than an opt-in version. Over time, this being not a common event, likely to shine a light then on just a few medical souls who are amenable to the task. Now, you just sense a turning of the tide here emotionally, though, as on discussion with numerous patients over the past decades that I have had the pleasure and privilege of dealing with, who in the olden days would simply wistfully state, "Well, Doc, when the time comes, I'm sure I can depend on you to give me that little green pill to put me to sleep permanently." It's a common fear indeed. It really is. For the, well, not always the great aged, but it's a common fear of a bad ending, being capable of incapable of taking such actions through lack of access, availability, kindred soul to assist in the matter. As we all know, much of this stuff then, a bit like planned births. Planned births, never seem to go to plan, as nature takes a hand and then chaos rules. Yes, the best laid plans of mice and men, or rather more precisely, the best laid schemes of mice and men, gang aft ugly, i.e. often go awry. So Robert Burns, in his poem to a mouse way back in the late 18th century, said. Clearly he knew a bit about human nature, and clearly it has not really changed that much in the few short centuries that has followed. Well, until next time then. Cheerio.